Bismillahirrahmanirrahim. This is a GI related MCQ. Let's see what does the question say. So a 29-year-old woman presents with several days of yellow eyes and dark urine. She reports similar episodes in the past. She recently started oral contraceptives. The examination shows mild scleral icterus. Labs shows total bilirubin is 3.8, which is surely increased. So that's a straightaway diagnosis. That's jaundice. AST normal, ALT normal, alkaline phosphatase is also normal. But the urinalysis shows bilirubin is positive and the urobilinogen is absent. That's actually a very important detail. Let's see what does the question ask. And the liver biopsy shows dark pigment within hepatocytes. Okay, what is the step number 1 here? Let's find out it's conjugated or unconjugated. So that's pretty easy. If you see bilirubin in the urine, it means that's surely conjugated, because unconjugated bilirubin is insoluble and you will never see it in the urine. So that's conjugated bilirubin. So just rule out all the options that do not contain conjugated bilirubin. For example, increased RBC destruction. Increased RBC destruction shows that you have a lot of hemolysis. What is hemolysis? Hemolysis shows unconjugated bilirubin. But the patient has opposite. Patient has conjugated bilirubin. That rules out this option. If the stem changed to anemia, high retic count, splenomegaly, negative urine bilirubin, then we would consider this option. But for now, this is the wrong answer. Option B, reduced bilirubin conjugation. So why is this the wrong answer? But can you please tell me what is the diagnosis? What does this show? This actually shows two things: Gilbert syndrome and the Crigler-Najjar syndrome. But again, Crigler-Najjar as well as the Gilbert both have unconjugated bilirubin. But the stem here, I already told you, if the urine contains bilirubin, that means the bilirubin, the jaundice is conjugated. So just rule this option as well. Rule this out. Option C, impaired hepatocyte bilirubin excretion. Okay, we can actually think on this option. Impaired hepatocyte bilirubin excretion. That's actually the correct answer. Now, why is this the correct answer? Because this is the classic pattern: recurrent mild jaundice, normal liver enzymes, conjugated hyperbilirubinemia, and dark liver pigment. This is actually the giveaway. Dark pigment within the hepatocytes. So the diagnosis here is Dubin-Johnson syndrome. Remember the fact: D for Dubin, D for dark. Okay, if you see the dark liver, that's Dubin-Johnson syndrome. Option D, let's rule out other options as well. Option D, CBD obstruction, common bile duct obstruction. Why is this also wrong? Obstruction causes conjugated bilirubin, but it also causes increased alk phos. Okay, whenever there will be a problem with the ducts, alkaline phosphatase will be increased, but here is alkaline phosphatase normal. Also, you will have right upper quadrant pain, itching, dilated ducts, but her liver tests are completely normal. Okay, so that makes it the wrong option. Option E is iron accumulation. Why is this the wrong option? This is because it clearly diagnoses hemochromatosis. Hemochromatosis gives you brown skin, diabetes, AST, ALT, not isolated bilirubin issues. So that's the wrong answer as well. Viral liver injury. First of all, you have to remember, you have to, make one thing completely fixed in your brain. Whenever there will be viral liver injury, AST, ALT will be raised to thousands. So that's the biggest giveaway that this is not viral liver injury. So the normal, the final line is dark urine plus bilirubin in the urine equals to conjugated bilirubin. Normal AST, ALT plus black liver. Always think impaired excretion, which is the Dubin-Johnson syndrome. Subscribe for more MCQs like that.